statute provides, quote, "It is hereby declared to be the policy of this state that the formation of public policy is public business and may not be conducted in secret. Every meeting of a public body shall be open to the public in order that citizens may exercise their democratic privilege of attending and speaking at meetings of public bodies, except as otherwise provided by the Constitution of the State of New Jersey, federal statutes, and the Open Meetings Act," end quotation. Notice of this meeting was filed with the Trenton Times and the Star Ledger newspapers. I will now read the council's vision. All individuals with developmental disabilities are contributing members of their neighborhoods and communities, make real choices, and have control over their own lives, have the freedom to strive, excel, and make mistakes, are in a position to achieve personal goals, are in a position to affect policy and process decisions that affect their lives, and have the same rights, privileges, responsibilities, and opportunities of citizenship as does any other New Jersey resident. I'm going to go now to the public comment. When we meet in person, members of the public are invited to speak. Since we're doing this virtually, we ask members of the public to submit their comments in writing, and I can read the comments. We have three comments. The first one comes from Laura Weinberg, which is actually a 4-page letter addressed to Jonathan Seyfried. So I'm just going to summarize the key points and then turn it over to Jonathan for his comments. Basically, the letter addresses two issues. One is the need to reopen day programs. Laura is a parent whose child lives at home, but I think this also applies to individuals who live in licensed facilities, that obviously the lockdown and keeping them away from their day programs has caused a great deal of stress. They have not been able to see their friends, and they have missed opportunities to socialize, to have physical activities, and to have educational opportunities. The second issue is really the funding of day programs. Jonathan, I'm sure, can address that, but what Laura is suggesting is that rather than have, as we currently have, half day programming coming as the state contribution and the federal contribution being limited to services that are actually provided in 15-minute increments, she suggests that funding should be capitated, which basically means set amounts for each individual, regardless of how many hours or minutes they are available to participate. And she notes that this is the way public education is going. Schools are getting full funding. They are not getting funding based upon how many minutes the students participate in online activities. So I'm going to turn that over to the Assistant Commissioner and Director of DDD, Jonathan Seyfried, to respond.
Good afternoon, everyone, and thank you to the council for having another of the quarterly meetings. So appreciative to be here today, and glad to see you all. In response to the first comment, first I'll talk about day reopening. We the division we did work with convene a work group related to day reopening to provide some recommendations. We did receive those, and we are looking to release requirements around day program reopening shortly. So we'll be able to put some more information around that, in the coming, in the near future. So more information to come on that particular piece. We certainly do recognize the disruption that no day services have caused for both people that live in their family home and in group homes, and are appreciative of the advocacy of the community to make sure that this important issue is addressed. In relation to capitation and rates, it is something that we are looking at. There are nuances compared to how the schools do it, and maybe even other states, because really the day services funding is within the individual budgets for each individual. So therefore, capitation, so on and so forth, would be a utilization of funds from an individual budget for services and hours of services they may not have actually received. So we're looking to see how all that would work to make sure it's fair, because if an individual is receiving 2 hours of remote service. But yet, if we change it to a capitation, the budget needs to be charged for 5 or 6 hours. That does impact the individual's ability to purchase services outside of those hours. So we're looking at that and seeing how we could possibly do that. We also need to work with our Centers for Medicaid and Medicare Services in terms of redefining those services. But it is something that we are looking at. We have heard loud and clear related to the challenge that both individuals and families are facing around day services, as well as the agencies that provide the services.
Thank you, Jonathan. The second comment was from, I'm missing the name here. Let me read it first and then I'll give you the name. This is from a self-advocate. I want to see my Pride Day program, See Friends Soon. I am Camp Acorn, dear friends wore masks and stayed apart, social distance. Thank you, William Aronow. And he included a picture of himself wearing a mask and a face shield.
Wonderful. Yeah. And so it was wonderful to see that letter and that picture. And I want to thank the individual for the question. And it's largely the same as my response related to the day program reopening. We have received the recommendations and have melded them into requirements to move forward, and we're looking to release them shortly. So we'll be getting more information out related to that particular to day program reopening.
Thank you. The third and last public comment comes from Andy Lee. This is a bit longer than the last one. I feel that DDD should reopen just like the public schools and colleges are starting to reopen, as well as put stringent rules in place. Also, I did hear that Easy Ride Flex T program is out of service permanently, but I want it back as soon as it's safe to do so, since the whole company itself is still in service. It affects me because I need to go to Primetime Center as well as Brookdale Community College. I also go to Brookdale Community College, but the problem is that they mix up the neurotypical and the special needs students in one classroom. Can you work with Brookdale and see if they can add a class section just for special education students? For example, also I have a problem with Attain and Gain. They denied the $4 increase, and as a result, they took off the Uber app and they suggested to use Lyft instead. I prefer Uber because more people are using Uber than Lyft. I know some of these issues don't really pertain to DDD, but the transportation reopening certainly do.
Certainly. Well, I think Easy Ride is, I have a little bit of insight into that. I think that was more of a business decision for that entity. And they made a decision that they were going to not, provide service anymore in that, in that domain. So they did reach out related to that, and I do remember seeing that particular piece. Different agencies are going to make different business decisions related to their work. They did not, as I recall, relay an issue with a rate or anything like that. It was more
Andrew
with the pandemic
McGeady
and so forth that they had decided that they were going to be going in a different way.
Has joined the meeting.
In terms of Attain and Gain, we did work with them, and I know that they are making some adjustments. Business-wise related to what services they're going to be utilizing. The division can't dictate to an agency to use one particular vendor over another. So I don't really have any direct ability to impact them, forcing them to use one service over another. And finally, related to Brookdale College, colleges, universities, public businesses, so on and so forth, do have to provide reasonable accommodations through the American with Disabilities Act. So if there is a challenge related to that particular, entity not accommodating somebody with a disability in the way they need to, I would certainly contact the administration there at the school to discuss what the needs are and to see how they can remediate that.
Thank you, John. And I would just add that it is the council's position that education should, wherever and whenever possible, occur in an integrated setting with appropriate accommodations for special needs. that is generally preferred to segregating special needs students in their own classroom, because we want to prepare special needs students for life in the community, where they will encounter non-special needs people. But again, just reiterating what Jonathan said, you need to speak out and go to your counselor or whatever authorities are at the college if you believe that the accommodations are not sufficient or appropriate. As far as the transportation goes, unfortunately, the COVID pandemic has interfered, but the council currently has funded a contract related to provision of transportation, and we're very hopeful that our contractor will come up with some very, very implementable suggestions for improving access to transportation for individuals with developmental needs. So please, Andy, hang on. We will ultimately get the results of that contract, and one of our priorities in our 5-year plan will undoubtedly be transportation. So this is something the council will focus on. I'm going to ask, well, I guess I already introduced myself. My name is Paul Blousey, and I'm chairperson of the council. I'm a family advocate. I have a 42-year-old son with developmental disabilities. Jacinta, if you could read the roles so that every member can introduce themselves for those who will avail themselves of the archived version.
I'm sorry, you just want me to read the names?
Yes, and I would like each person to just introduce yourself, whether you're a self-advocate, a family advocate, or whether you are representing one of the organizations that are members of the council.
Okay, so the next person I see is Peg Kinsell.
Peg, please unmute.
Right, I got it. Sorry. My name's Peg Kinsell. I am a family member and member of the council.
Okay, I see Todd M.
Todd is also muted.
I'm gonna try to unmute him. Just a second. Go ahead, Todd. Oh,
If you're a member of the council, you have to.
there you go. Todd.
If we get no response, can you just introduce the member who doesn't respond so we can move
Yes,
on?
this is Todd Emmons. He's a member of the board. He's the next person I see is Annette Smith.
Okay, hold on, please. I just gotta.
Annette, you can go ahead and unmute yourself, because if I try to do it, we'll play tag.
It's okay. I just unmuted. My name is Annette Smith. I am a family advocate. My daughter Tiffany Smith is 37 years old and needs total care. She lives at home with me.
Thank you. The next, Robert Artis.
Hi, I'm Robert Artis. I work with Jonathan at DDD. I'm in charge of the family outreach and family support.
Thank you. The next person I see is Ellie Byra.
Hello, I'm a family advocate. My son is 44 years old, living in a shared living arrangement.
Go stop it.
Okay, thank you. The next person I see is Frank Latham.
I am Frank.
I know. I thought it was
council staff.
Thank you. The next person is Helen Steinberg.
Hi, I'm a family advocate and I'm a member of the council.
Thank you. Kelly.
I'm sorry, did you say Ellie?
No, Joyce.
Come on, people, let's go.
Hi, I'm Joyce Jelly. I'm with the Bog Center.
Thank you. Jill Hogel.
Hi, good afternoon. I'm the representative of Disability Rights New Jersey, the Protection and Advocacy Agency.
Thank you. Jody Fox.
Yes, I'm a member of the council.
Kyle Picone.
Yes. My name is Kyle Bacone. I'm 124, and I'm here. I'm on this meeting.
Kevin Nunes.
Hi, I'm Kevin Nunez. I am the council vice chair, self-advocate, and family advocate because several members of my family have disabilities. So I'm both. Happy to be here and hope everyone has a good day.
Thank you. Rebecca Novemsky.
Hi, I'm Rebecca Novensky. I'm council staff. I also have Myrna Rosen on the line. Myrna, go ahead and introduce yourself.
Oh, is that person?
Mm-hmm.
What does he have?
Sophia, can you mute yourself for a second, please?
I'm on the Council of Developmental Disabilities, that's why.
I thought the fact that these people have to be like helped 24/7.
They do, they have an aid.
I know. I don't want aid.
Sophia.
I think Phyllis Melendez. I think you need to mute yourself, Phyllis.
Oh, thank you. The next person is Kyoko Coco.
Hi, I'm sorry, Jacinta. Are you ready for me? There was a lot of background noise.
I'm sorry, no, not yet.
Okay. Okay. I was muted though.
Thank you.
Okay.
Hello, everyone. Kyoko Coco, council staff.
Okay, now Phyllis Melendez.
Yes, good afternoon. This is Phyllis Melendez. I'm here representing the Division of Medical Assistance and Health Services on behalf of Assistant Commissioner Jen Jacobs and Deputy Director Carol Grant. And I was muted too. I was muted also. So I'm not sure where you're coming from.
Thank you. Ryan Roy.
I'm Ryan Roy, resting comfortably in my bed. I'm actually a self-advocate with a minor developmental disability. I am actually a co-chair for Bergen County's People First, and I actually wear many hats. I'm actually today's the birthday of my 4-year-old. Tomorrow he'll be celebrating turning the big 5. So, oh, okay, all right. Let me just do that for yeah. Yep. At least everyone can see me now.
Thank you, Ryan.
Mm-hmm.
Thank you. Is Paul Aronson.
Hi, good afternoon, everybody. Paul Aronson, family member and ombudsman for individuals with intellectual developmental disabilities and their families.
Thank you. Next, I have Bill Testa.
Good afternoon. I'm the public member of the DD Council, and I serve as executive director of the ARC in Morris County.
Brenda Considine.
Hi, everybody. I'm Brenda Considine. I serve as staff liaison consultant to the subcommittee on children and youth, and I'm facilitating the council's work in the area of the production of the 5-year plan.
Thank you. I have Gary Brown.
Good afternoon, everyone. I'm Gary Brown, council staff.
Thank you. Jackie Moskowitz.
Good afternoon. I'm Jackie Moskowitz. I'm the Assistant Division Director at the Division of Disability Services.
Thank you. Sarah Aziz. I thought I saw her. Maybe we lost her. Next person is Safia.
Good afternoon. My name is Safia Mohammed. I am a family member and a council member.
Thank you. And I saw a caller too. May I ask who's on the phone?
Jay, I think you need to unmute the callers.
I just clicked.
Andrew reported he is on the line.
Okay, Andrew is on the line. Okay. And then there's a caller number 4.
I think that's some people that are on both systems. So I think we've got everybody
Okay.
captured at this point.
And then there's you, Mercedes.
Hi, Mercedes Witowski. I'm the Executive Director at the Council, and I'm also a parent of a young woman with disabilities.
Hi, and this is Karen Carroll. My name is not coming up, but I'm the Director of the Division of Vocational Rehabilitation Services and a council member.
Thank you. Okay. I want to welcome members of the council staff, and members of the public, although I realize members of the public will be seeing this archive. I realize you're all under unprecedented level of stress during this emergency, so I certainly appreciate you taking the time to join us. I personally am very grateful for the opportunity to be a member of the council. I like, admire, and respect all members of the council. It's a great privilege for me to serve with you. I want to thank council members for their efforts to engage in council activities during this stressful time. I understand the challenges to you all as you care for your families, perform your work responsibilities, and also devote time to the council. I want to especially thank members of the executive committee who have enabled us to do bi-weekly meetings. Also the planning committee and the Children and Youth Services subcommittee who have continued their critical work on a regular basis. I want to especially thank Peg for being in the forefront of advocacy for children's issues. In addition to being a great advocate, she has kept all of us informed on what's going on. Thank you, Peg. I want to thank Brenda for her outstanding work on the 5-year plan. Her extensive outreach efforts have produced an amazing number of survey responses and comments. Brenda and Helen have conducted 5 open town hall meetings. I will leave it to Helen and Brenda to provide details, which are the focus of this meeting. I thank the council staff for maintaining operations while working from home, while you don't have access to either your office or your colleagues in person. I also want to thank the outstanding work of our partners, the Boggs Center, Disability Rights New Jersey, and Paul Aronson, the Ombudsman. All have been active advocating, informing, and empowering our population. They have been outstanding collaborators for the council, so thank you all. Most of all, I need and want to thank and recognize Mercedes. She has maintained council operations under very difficult conditions. She has increased the role of the council and awareness of the council on the part of the public. She has been a leader in statewide advocacy. She has maintained regular contact with state agencies, the 3 trade associations, the Boggs Center, Disability Rights, the Ombudsman, our National Association, NJCDD, and many other advocacy groups, self-advocates, and family advocates who are too numerous for me to mention. She's been the leader on multiple critical issues, including electronic visit verification and the so-called Billy Cray bill on cameras and licensed facilities. I'm sure I left out many of her accomplishments, as I'm sure you realize how essential she has been. So thank you to all of you, and especially to Mercedes. In my executive committee comment, I want to address three issues. We're all aware that COVID-19 has placed disproportionate stress on individuals with developmental disabilities. No one can dispute that those challenges are even greater on our racial, ethnic, and low-income friends and neighbors. To address the disparities in their access to services, I'm invoking a bylaw provision to establish an ad hoc committee to address these inequities. While this is a prerogative of the chairperson, due to the importance of these disparities, I'm asking the council to express its support. The executive committee has already given its unanimous approval. I am glad to report that Sophia has graciously accepted my request to chair the ad hoc committee. I can't think of anyone more qualified. She will recruit members from the council staff, and the public. Since an ad hoc committee must report to a standing committee, Sophia will report to the planning committee to ensure that all aspects of the 5-year plan encompass the needs of these special segments of our population. Since ad hoc committees must have a specific expiration date, I've selected October 1st, 2021, the date when the new 5-year plan goes into effect. I hope that the 5-year plan will incorporate all the work of the ad hoc committee. Of course, we can reinstate the ad hoc committee if that is necessary. The second issue is the Olmsted update. The Olmsted decision of the Supreme Court basically stated that it was the responsibility of states to provide opportunities for individuals needing services to get them in the community so that they did not have to go to institutions to get the services they need. Excuse me. The Olmsted settlement in New Jersey addressed the population of the developmental centers, not what services would be provided in the community. So we have been very, very successful, and I have to salute Jonathan Seyfried. Jonathan was the person who basically ran the Olmsted program in New Jersey, and I had the pleasure of serving on the Olmsted Implementation Advisory Committee. We went from 7 developmental centers down to 5. We reduced the population in the developmental centers from about 2,500 down to about 1,200, but we never really carried out the second part of the Olmsted settlement. It was not just to remove people from developmental centers or institutions. It was to provide services that they could receive in the community so that they would not be faced with either not getting services or going to live in an institution. Under Mercedes' leadership, we had an initial meeting that included council staff, disability rights, and the Boggs Center. And I have to thank the Boggs Center for giving us tremendous historical information. Deb Spertalnik was wonderful. I also want to thank Gwen Orlowski and Disability Rights New Jersey for taking the leading role on this follow-on to the Olmsted settlement, which they basically took care of. So stay tuned. We will continue to focus on this issue to make sure that individuals do not have to either not get services, go into developmental centers, or go into nursing homes. Our population does not belong in nursing homes, nor do they belong in developmental centers, but they do need services. The last issue is electronic surveillance. Joan Delaney's Assembly Committee on Health and Human Services is considering Billy Cray's law, which would allow for electronic surveillance cameras, basically in licensed facilities, group homes, and supervised apartments. We initially were very concerned that, and I still am, that individuals would be pressured to accept surveillance if most of the guardians or residents of their group home wanted it. And we did not feel it was appropriate for an individual to have to leave their group home if they didn't want electronic surveillance. We have since been in contact with a number of members of the statewide Family Support Planning Council who have passionately supported the option of having cameras in group homes. So in order to hear all versions, Mercedes again has gotten together a group of people with different perspectives on this issue so that we can try to come up with a consensus view that will satisfy everybody, although perhaps not give everybody exactly what they want. So we will be meeting next week with agency representatives who have successfully utilized cameras, as well as some parents to explain why they think it is important. Again, it's important for the council to be involved in this issue, but not to be too hasty in coming to a conclusion. And as I said before, our basic objective is to try to come up with a consensus that will satisfy the different perspectives and different needs of people without imposing mandates on individuals. And also, we have been in contact with the 3 trade associations, and they have a valid concern that an unfunded mandate would cause them to have to spend money on setting up the cameras, monitoring the cameras, maintaining archives of the output of the cameras, and protecting that archive from unjustified and unauthorized access. So there are a lot of moving parts here, a lot of issues, and I'm hoping that the council can help the stakeholders come to a good and final resolution of that issue. I also do not like the idea of legislation solving these issues. Legislators don't have the expertise to fully understand the issue. And when they pass a bill and sign it and the governor signs it into law, they're not going to want to go back and make changes to accommodate the unintended consequences. I think my personal view is it would be far better if the administrative agencies like the Department of Human Services would create policies and procedures which could be more easily amended if needed, and also would be the result of far more knowledgeable people. The DHS people know far more about the operation of group homes and supervised apartments than do the legislative staff. So I'm really hoping, we could solve this issue or at least come to a better solution than the proposed Billy Cray's bill. But we will again be meeting with the trade associations, with Paul Aronson, Disability Rights, the Bog Center, and hopefully we can come up with a consensus solution. Anyway, I'm going to go a little bit out of order now because Mercedes has to leave to take her daughter for a medical appointment at 2:00 or 2:30. So let's skip over to Mercedes and make sure that she has enough time for her executive director's report.
Okay, Paul, thank you. Thank you so much. Thank you for your leadership throughout this entire time and the support and late nights, early mornings, weekends. Paul, you never give up, and we appreciate that. I also want to thank our Vice Chair, Kevin, who is fairly new in his role, but certainly not new to advocacy at the council. I also want to really extend my appreciation to all of the council members and to some of the members on the call today that are waiting to be council members. You're all really just showing how true your passion and commitment to this work is, and working so well on anything that you're asked. So thank you all. The collaborative efforts that we've been able to continue to engage through COVID wouldn't have been possible without the groundwork that took place before, but they're so important right now to work together, and there's so much that we have done in the last 5 months. I do want to keep in mind, though, and remind us all that despite what we've seen and how it's redirected us during COVID, the council's current 5-year plan is a plan that we're still expected to fulfill through the Administration on Community Living and continue to do our reporting on the goals and objectives. So with that, I'll take us through our current objectives to make sure that I've given you as quick an update as I can during this call. And then there's a lot more detail in the report that I've already provided you. Before I go there, I do want to let you know that there have been 2 personnel changes at the council. We have 2 council staff that are no longer working at the council, and they are Denny Todd and James Brill. And I will keep you posted as those positions are filled. So in terms of self-advocacy and family training, and I'll preface this with all of our contracts. If they did not end at the end of March, they have been extended for some for 3 months, some for up to a year, based on the work within those contracts and the activities that needed to be performed and the ability to perform them, many of which were in person. So as I go through some of the updates and I talk about contracts, please note that we have contract extensions on almost everything, and their work, our contractors' work, are continuing along the lines of their activities and in concert with the impact of COVID. So the contract for self-advocacy and family training through the ARC of New Jersey, the DDD training resource website is continuing to do its job. You can access that material with postings and information on trainings at ddtrainingresources.org. We also, the work of the family advocates in completing a updated new resource quick guide for explaining the community care program and the supports program is available in English. Hard copies continue to go out of our office, and you can email us at njcdd.org if you need any hard copies in English of the new quick guide for community care support, community care program and supports program. A Spanish version is being developed and will be available shortly. Both will be downloadable. The English is currently downloadable online, but hard copies are also available. I also want to congratulate Rebecca Novemsky and Kyoko Koko for successfully completing the Charting the Life Course Ambassador Series training, along with Representatives Patricia Brennan and Nkechi Agoji from DDD and Colleen McLaughlin at the Bog Center. Many of the Family Support Planning Council members and the leadership of those councils will play an important role in the Charting the Life course work that we have partnered with DDD and the Bog Center. And you will be seeing dates for trainings starting in September. So we're very excited about that. Also in collaboration with Gary Brown and Maria Ali at the council, we do have a lot of activity on our Facebook pages for Family Support Planning Council in their Words of Wisdom and Encouragement campaign. This is a time when we really need to be together and support one another, and those they've gotten a lot more followers as a result of people just communicating and sharing their support for one another. Frank Latham is currently working with our People First groups, and we have several groups that are using the Leadership Handbook, and we know that there are more opportunities to engage these groups in virtual meetings, which are underway. And our self-advocates, as we began discussing late last year, are planning a self-advocate education day that is tentatively being scheduled for the fall. And they will conduct that over several weeks with short sessions. Lots of work and activity on the direct support staffing issues. So please look for the many communications out on the Coalition for the DSP Living Wage and the work that they're doing in ensuring that the state's minimum wage increases have a comparative increase for indexing the DSP wages. I'll talk quickly about special education advocacy. I want to highlight that our contract with SPAN We just recently learned from SPAN through the SAVA project that they were successful in securing New Jersey Department of Education funding to continue that project. That is great work when the council can invest in projects that ultimately continue by showing how important they were in achieving their deliverables, and we can have those projects continue on beyond the work of the council. So great investment dollars. Thank you to SPAN and the SAVER project. For employment, that DDAN, Developmental Disability Advocacy Network group, and the New Jersey APSI board and the Bog Center have really been working hard on continuing their efforts around the impact of Medicaid and income and unearned income in maintaining Medicaid benefits. They've submitted testimony to the state rehab councils and DVRS in a public forum. They're meeting with legislators, so I want to commend them on the great work that they're doing. In transportation, I want to congratulate the advocates, People First, and the Centers for Independent Living, and the governor's announcement of signing recently on August 12th. He signed a law regarding Senate Bill S 362, requiring New Jersey access to operate during a state of emergency. So I want to show our appreciation for their work. Under health and wellness, as Paul mentioned, or maybe didn't mention, there is a health and safety subcommittee that has been working on issues important to families and individuals living in residential settings. So more to come on that. Excited for the conversations that are going on there. And then I'll tell you that our contract with Shaw has they've now completed their work on a housing navigator training, and the sessions that have been slightly delayed, but the curriculum is done and the trainings will begin in September. So that was a lot, and there's a lot more activity that is in the report. More specific to COVID, the advocacy work that we've done and continue to do, Paul mentioned much of it, but please know that issues like personal protective equipment will remain a priority and an advocacy area for us at the council. Accessing family visitation and the policies around family visitation, opening day programs, access to technology for remote services, continuing the parent, spouse, and guardian as self-directed employees, children's services and access to educational services and entitlements continue to be pressing issues in advocacy for the council. And then in collaborative work with our DD Act partners, we will continue to host and probably resume town hall meetings in September or early October. So be on the lookout for that. I also want to remind you that our NJCDD website does have a COVID pop-up where you can access some of the critical links to materials that are available electronically, and we continue to work toward bringing people the information that they need. I think that pretty much covers, except for what's in the a lot more details in my 9-page report. I'll take any questions if you have them, though I'll check the chat. Thank you again, all.
Mercedes, I just have one question. Since we are reading in a virtual environment, is the packet that the council members received going to be available to the public on our website?
We have not, because we've had these meetings live recorded and viewing live. We did not do that at the last meeting, but I'm open to that suggestion for this meeting, considering that we were not able to get a live stream. But whatever whatever Jay typically provides as the packet at the public session, we can make available.
Right.
And I just want to apologize for that. Today just really has been a day, not just on our call, but on some other calls that I participated in. I don't know what's happening with technology, but we had every intention that this was being live fed onto our YouTube channel. So Jay is recording this session and it will be provided live. And thank you, Kevin. We will make a hard copy of the packet with the reports available.
Okay, thank you. Let's go back to the agenda. Ellie, update us on the policy committee, and Peg, Children and Youth Services Subcommittee, which reports to the policy committee. Ellie, unmute. Ellie, can you unmute?
You can't hear me on the phone?
Oh, now we can.
Paul?
Now we can.
Okay. All right, thank you. I just want to say first that today will be my last meeting as chair of the policy committee. I really think it's time for Paul to appoint someone much younger. And there are so many people just waiting in line to come onto the council and to participate. So I think this will be my retirement day. But in the meantime, I know that all of you are so involved in the coronavirus and the impact that it has had on our community. And the DD Council has been an outstanding mover for us in that way. Excuse me. Mercedes has testified before the Assembly Human Services Committee in June and actually has put the DD Council as a driving force in public policy efforts for us to support the needs for data and stakeholder input. The collaborative partners that she's been working with in terms of leadership of organized statewide and disability inclusive response for possible budget cuts due to the shutdown. A disability collaborative was established and about a year ago and has been essential in the planning of a campaign in anticipation of State Department budget cuts, which we all are beginning to feel here. The DD Council State Budget Crisis Task Force and the national, it's really been the national collaboration of partners that has established information for the task force, including a tool kit that clarifies the message that they are trying to get out and disseminate in an effective way. We've had a message of no cuts was discussed with the collaborative, and we're not the only one. Most states are stating that their services budgets are already minimal and that any cuts would be catastrophic, and to us as well. Mercedes has taken a leadership role in New Jersey's advocacy to preserve disability services. And as you all know, the campaign is already underway because you are getting emails on a continuing basis. A disability caucus plan has been developed with ABS, that is Association Business Solutions, that has been helping with our budget issues here in New Jersey. They've had conversations with Senate President Sweeney and Speaker McLaughlin. What they are hoping for is that these discussions will begin a partnership in governance and not end at the end of this crisis. And ABS will try to keep that going for us. The council's regional family planning support councils and council members will be requested to attend meetings with the legislators. And I know many of you will be contacted and volunteering on that. Position papers have been developed, and I know Paul has already talked about Bill Cray's law that is still in the works, but position papers are being talked about and continues on the virus. School safety bills, disability employment, overtime, assistive technology, and the restroom signage. It's been a busy year for a number of reasons. And I think that's about it. Peg, would you come on and talk about children and youth for us, please?
No, certainly, Ellie. Do you have it?
Yep.
Okay. The subcommittee on children and youth met in May, June, and July. We did take August off. That's our rest period, but we stayed busy throughout that time. There was a focus for definitely the last 6 months, if not the last year, on CSOC service, children's services, the Children's System of Care. And so we had worked, gathered data through the committee, the advocacy efforts that committee members had, and put together a huge list. And then Brenda thankfully revised and, scaled down the list so that the people from Department of Children and Families didn't run screaming from us. And we did finally get a meeting, a telephone conference, of course, like everything else is now, with Lolita Johnson and Molly Green, and discussed some of our concerns, and tried to focus most of our stuff on accessing service in the application process, which I'll talk about in a second. But the complete list of things that we dealt with, or that we asked them to deal with, will be found on pages 2 through 4 in the documentation you got. I just want to come back there for a second. Actually, Mr. Aronson and I had the pleasure of testifying today in front of the Women and Children's Committee, because they were focused on DCF and the COVID implementation. But since we got to talk about the implication of COVID on families of children with intellectual and developmental disabilities, we also then were able to kind of start with, well, here were problems even before COVID, and this has exacerbated it. So I will be talking to our committee and the bigger council. I'd like to put together some comments or testimony to give to that committee, because they seem interested, and we're starting to kind of grasp how big the problem might be. So some of the other issues, it's really everything about COVID, children and youth, and what the implications of that are. I'm so glad to hear about the committee that Sophia will be chairing. We have a focus on racial inequity and disproportionality on our committee as well. So any way that we can support your work, we'd be happy to do. We continue to look at the issue of seclusion and restraint. I have some more concerns right now with kids getting ready to go back to school, and what the implication of those kind of procedures on kids, especially kids that might have masks, are already be upset with the transition back into school. And I've heard some really scary stuff from some staff and from some other advocates about ways they think they might have to implement behavioral supports, and I say supports with complete sarcasm, for students that may be biters or spitters, and all the way from suggestions of seclusion to those good old-fashioned sensory hoods. So it's something we're gonna have to watch very, very carefully, and I hope to keep that on the front burner. I know it's a commitment in our committee. And so I would, that will be one of my recommendations as a bigger policy issue, is to write to the Department of Ed and say we think there needs to be a moratorium on all restraint and seclusion during this reintroduction, because we know a lot of kids have been traumatized and a lot of kids are going to have issues with transitioning back to school. And then the other thing is our wonderful, beautiful school safety bill. We have a piece of legislation. That work was so well done by the community, by the committee, by the bigger council. But everything's really just another thing on hold because of COVID. And my last COVID statement is the problem. One of the other impacts of COVID is that we don't get to have baby showers and birthday parties and going away or recognitions of people's service. So from my piece, I would like to say thank you to Mr. Brill for his contributions to the council. Danny and I go back 150 years to when I worked at the NJPNA. So we'll miss her, and we want to thank her for her contributions. And Ellie, I don't even want to say how far we go back, but
Thank you. Thanks, Peg.
I'm just sorry that we can't celebrate in the way that we should. And that's the end of my report.
Thank you. I have one correction. I find it impossible to believe that Peg took August off. I don't think she's capable of taking time off.
I did August off. The committee took August off.
Yes, the committee did not meet, but I'm sure that Peg was as active as ever, and we greatly appreciate everything that you do, Peg. And I just want to say a regret about Ellie. If there were a Hall of Fame for disability advocates, Ellie would be the first inductee. Throughout her career as an advocate, she has just been absolutely wonderful. She's always been there. She's always been on the right side of all the issues. She's always been there to encourage other people and provide them with guidance. I knew absolutely nothing until one day when I wandered into a regional family support planning council meeting, and the first person I encountered inside the door was Ellie. And I basically devoted the last decade to trying to absorb all I could from her, learn as much as I could from her, and to the extent possible, follow in her footsteps. So I want to make it perfectly clear that anything I get right is a result of Ellie's tutelage, and anything I get wrong is because I failed to pay adequate attention to her advice. But I want to just express my warmest thanks to all you've done, Ellie, and I'm just glad that you're staying on the council.
Oh, thank you, Paul. You've done a great job. I'm so glad we got to influence you.
You certainly.
Thank you.
Okay, the next report is the Grants Committee. Vice Chair Kevin Nunez. Kevin, are you there?
Hi, can you hear me?
Yes.
Okay. Hi, everyone. I'm Kevin Nunez. As Paul mentioned, I am the chair of the Grants Committee. Before I get into the Grants Committee report, I just want to say, as an advocate, and as the vice chair of the council, and as an advocate, we have a good chance here with COVID to reinvent how important advocacy is and how important advocacy matters. Because whether you want to admit it or not, the world has changed, and we need to adapt to whatever the new normal is going to be. Um, I don't think it takes a scientist to tell you that this virus situation is not going to go away anytime soon. So we have a good chance here to reinvent ourselves and do more advocacy, because one of the benefits I found is with virtual technology, those of us who can speak for others can actually do more because we don't have to worry about transportation. Um, so that gives my 2 cents. And of course, I echo the sentiments about Ellie and her great work with public policy. Uh, I echo the sentiments about Denny's and James's departure from the council. Um, as far as the grants committee goes, I don't want to regurgitate what Mercedes already said. The documents you will have in front of you. The biggest thing is we got an extension from the national organization to extend our contracts. Um, like we said, our 5-year plan is still being upheld. We've done a lot of work with the planning committee. We've had several grants, and for example, the dental grant with Columbia University. If you go on our website, it actually gives you a directory of available dentists that are friendly to our community, both in English and in Spanish. The Bog Center finished their criteria with students in the mental health profession. So it basically teaches students how to interact with our population. Um, the in our own words transportation guide recommendations has been done and is also available on our website. Um, the mental health toolkit or crisis handbook is also available on our website. So our website actually has a lot of resources to help families with products that either have just ended or are about to end. So I highly recommend that you go down our resources page and our current grants page to see what we have done. Like Mercedes said, the ARC databank has also been up and running for almost 2 years now and is a fabulous resource for people and families to keep accurate, up-to-date trainings and material on what they need. Um, we've done a lot of work. We had an emergency fund basically set up to help people and families stay engaged during the stay-at-home order. We really did tremendous work there. It was a very excellent collaboration with the ARC of New Jersey to provide things like tablets, trampolines, art supplies, things like that, little things that really made a big difference in someone else's day to actually keep engaged during these difficult times. We also did the same thing with providers. Um, so it really was an excellent collaboration with the ARC. I want to thank them for that. They did a lot of the brunt work when it came to processing applications. The committee actually have only met once because the executive committee had to take so much action when it came to the emergency response of the funds and the families. Um, like we said, a lot of our contracts have gotten extended, so we kind of had no choice due to COVID. So the committee has been active, even though we haven't officially met. We've done a lot. We've stayed on task with our 5-year planning goals. I really, really want to emphasize this. The grants committee is identical in membership to the planning committee. So please, as we go forward to, with the process to our next 5-year plan, please pay attention to all the communications and be as involved as you can with the 5-year planning process. I think that's all I have. Once again, thank you, Ellie, thank you, Jenny, and thank you, James, for your tremendous work. And if you have any questions, please feel free to call me anytime. As far as the advocates go, this is a good chance for us to really reinvent ourselves and speak out for those who can't speak for themselves. As one of our advocates always says, I don't just speak for myself, I speak for everyone. So we have a good chance here to do more with these new technologies.
Paul, you're muted.
Thank you, Bill. At this point, we get to the pièce de résistance, the focus of the meeting, which is the 5-year state plan. As I mentioned earlier, a tremendous amount of work has been done, a very innovative means for getting access to people who have never had contact with the council before. So I'm going to turn it over to the State Plan Committee Chair, Helen Steinberg, and the staff liaison, Brenda Considine, to update the council on what's been going on.
Okay, good afternoon, everybody. I have a short report of it's kind of a summary of the feedback from our public hearings and focus groups. And it is done in a little different format than I've done in the past. Something very unusual for me, actually. And it's not from my viewpoint, but it's written from the viewpoint of a self-advocate. So it could be my son, or it could be any of the other self-advocates. So here we go. See me. I'm someone's child, someone's grandchild, someone's sibling, someone's friend. I am someone. I live each day needing love, needing respect, needing very special caregivers, needing the support of a caring community, needing a safe place to live, needing appropriate medical care and coverage, needing a safe and dependable transportation system, needing recreation activities, needing someone to talk to me. Don't see my disability. Don't see my race or ethnicity. Don't see my shortcomings. See that I have desires, see that I have feelings, see that I have some skills, see that I have my own personality. See me. And also, before I go, I want to thank Ellie. Ellie, I don't know whether Peg goes back longer with you or I do, but it's been a long time, and you've been a wonderful advocate. And we'll certainly miss you, and we'll as the chair of your committee, and we will miss Denny and James. Thank you. And Brenda, would you like to take over now? You're muted.
There we go. Can you hear me now? All right. So before I get started, I'll apologize. It seems like today is such a beautiful day. The two neighbors have chosen it as a great day to begin sanding their home. So there's a lot of background noise right outside my home office. So if you hear that and it's disturbing, I'll apologize for that up front. I'm also going to take a minute before I get started to acknowledge Ellie's work. Ellie, I think I knew you when Matt was maybe 11. So imagine my shock to hear that he has aged and we have not. You have been a mentor, a leader, a policy Sherpa, and we all owe a debt of gratitude to you for the work you've done. Don't go anywhere just yet because we still need you. So with that, I will say that the work on the 5-year plan is exhilarating. I'm going to ask Jacinta to put up a PowerPoint presentation. I thought for those of you who are more visual learners than auditory learners, a PowerPoint might be easier to follow along than to listen to me drone on. Jacinta, can you do that for me?
Brenda, I'm going to transfer permission to you because my computer is being temperamental.
Okay. I am not set up to do that right now. I've got
Oh.
All right, let me see if I can do my best. Give me a second here.
Okay.
I'm actually on a different system, and that's a PowerPoint, and I'm going to use Keynote where I am, and I don't know how it's going to load. Okay, we will do Plan B. Is there anyone else at the council who could load that? Let me see if I can get that loaded. Let me just see if I can make that work. Give me just a second here to see if I can do that.
Okay, just a second. I'm getting maybe something.
I'm going to try to load that and see what I get here.
Brenda, in the meantime, this is Gary. If you want to email that to me, I'll save it and I'll see if maybe Jay can make me the presenter somehow.
All right,
if it doesn't work out for Jay.
I'm on a Mac system, and I think this can open, but I usually use Keynote on this, and I don't. Well, since it's the day for technical difficulties, it seems like what ought to be happening now. Yeah, all right. I'm going to do that, Gary. Again, I apologize. I'm usually on a different system, and I am not. Okay. All right. I just am sending that to Gary. I'll just begin the discussion, and then we will let ourselves catch up with the PowerPoint. So you'll find on page 10 of the material that was sent to you a kind of summary of what we've been doing and where we are. The 5-year state planning process is one of the most important strategic planning activities that the council engages in. It basically calls upon us to ask 4 questions. Where have we been? What are the needs? What's our vision for the future? And how are we going to get there? And we are sort of straddling between question 2 and 3 right now. What are the needs and what's our vision for the future? I'm going to invite all of you to really pay close attention as I start to go through this, because as we wrap up, there is a call to action. I'm going to be inviting every one of you. And I say inviting, but I think Paul really means kind of requiring. We're going to be asking each member of the council and those of you that are waiting in the wings for full appointment to serve on one of 3 work groups that's really going to dive into some of the nuts and bolts of planning. You'll have a lot of support, but we're working closely with these work groups to help generate content for our report. So what are the requirements of the DD Act? The DD Act requires us to do a comprehensive review and analysis. That's the part where we kind of take a look at the state of the state, what the needs are, what the data show, what the demographics are showing. We're required to develop plan goals. And here we're going to go small, believe it or not. We're going to go small and go big all at the same time. We're going to be looking for goals that are broad enough to describe the kind of system change that we're looking for, but not so big that they're unattainable. We're going to be looking to develop goals that are specific and measurable, but not so specific that they limit what we can do. And this is where really looking comprehensively at the information that we collect and thinking of it broadly is going to be very helpful. We're going to be developing assurances getting public input and review, again, with sort of where we are now. And then we're going to consult with our designated state agencies. So it's a multi-step process that's required of the DD Act. Mercedes and I have been taking part in a number of technical assistance programs offered by NACDD. They've been very helpful. I've also been working with our neighbors in different councils to take a look at what they're doing, how they're structuring the process, and the way in which they're going about developing their 5-year plan. So we're not reinventing the wheel by any stretch of the imagination. So we're doing the work in 5 phases. Phase 1 began in February and ran through May, and that is kind of our planning and preparation phase. Where are we now? That was when Helen and I worked together to set up the planning subcommittee. We developed strategies, laid the infrastructure, began to develop the survey. I did interviews with each staff person, deep level interviews, to sort of find out what they thought the priorities were, where the issues were, where the challenges were from their perspective, and where to look for data, because we really did want this to be a data-driven approach. Phase 2, we're just finishing that right now. That was March through August. That's what we're calling the comprehensive review and analysis, where we collect data and public input to try to assess what is needed.
Brenda?
Yes.
This is Gary. I'm going to just jump in. I have the document, and if Jay could make me presenter, I'll share my screen. Just keep talking, and Jay and I can work this out, and we'll see what we can do, okay?
Beautiful. Thank you. So in phase 2, as I mentioned, was March through August. That's when we worked to develop a survey instrument and other outreach strategies. And I would be really remiss if I didn't specifically thank some folks. I'll start with Sophia. Sophia was really helpful as we did some planning about outreach and messaging to diverse communities. She gave me great feedback. And with her help and guidance, we were able to develop a very comprehensive outreach list to church groups and community groups with a focus on different languages in our state and different cultures in our state. So well before this committee came to be, Sophia was very helpful in thinking about, helping us think about ways to reach a broader group of stakeholders. On the staff level, Kyoko has been hugely helpful with the back-end assistance with survey development, including the work that it took to get that survey up in 4 languages. The survey was up in English, Spanish, Chinese, and Portuguese, the 4 most common languages here in New Jersey. Gary Brown has been incredibly responsive and very helpful with marketing and outreach. Frank has been a huge help with outreach to self-advocates and students, and Maria for her technical support and web support. So, and of course, Mercedes, who's hands-on everywhere we go, which I really appreciate. So during this data collection phase, we have, hold on, we can advance, Gary, to what would be slide 5. Okay, so slide 5 has us in phase 2. There we go. Okay, perfect. So during this phase, CCS, my office, has been doing a lot of research, taking kind of a deep dive look into getting a snapshot of New Jersey from a demographic and service delivery point of view. But perhaps the most important kind of data collection that we've done, next slide, please, has been to really dive into community input for what is needed, what we need by the consumer experience. Thank you. So during phase 2, we've been really busy collecting input. During the months of June and July, we held 5 public hearings, virtual public hearings. We only had 1 that had technical issues, but we still got through it. Kudos to Jacinta for being the wizard behind the screen and making things work. It's not an easy task, I'm sure, when people are clamoring to get in. We had 244 individuals register for our public hearings. We had 48 deliver testimony, very compelling. We had 2 Spanish language focus groups with 28 register and 12 giving comments. And then we had more than 1,000 individuals respond to our digital survey. And it's ironic, when we first started, I said to Mercedes that if we could hit 1,000, I'd be happy. And we got to 1,009 before we closed. So I'm happy. That 1,009 included respondents in Chinese and in Spanish. No one took our Portuguese survey. But the breadth and scope of respondents was absolutely incredible. We had 22 individuals submit written comments. I did phone interviews, and we also had assisted support for survey participation. And I'll just give a shout out to Allison Melnick, who volunteered to help us fill out surveys for people, paper surveys, so that it's been a tremendous effort. By way of consumer participation in our digital survey, 6% of those who responded were individuals with developmental disabilities, 67% were family members, 17% were providers, 8% were government agencies, and 8% identified as other. I'm going to have more data for you. We just closed the survey on Friday, and we're in the process of sort of sorting all of that out right now. But I'm very, very pleased with the responses that we got. I do have a couple of screen grabs, and I can just verbally tell you that a little bit of demographics. 76% of the individuals who responded identified as white or Caucasian, 8% identified as Black or African American, 8.4% as Hispanic or Latino, and 4% as Asian or Chinese. 5% preferred not to identify. In terms of where we heard from people, 58% identified as being living in suburbs, whereas about 30% said rural or small town, 12% said urban or city. Interesting, the issues. We asked people to identify issues that really mattered to them, and we asked some very deep dive questions. I hope those of you on the call did take the survey. In terms of the issues that mattered most to people, housing and independent living, we had almost 48% of our respondents indicate that that was one of the most important issues, followed closely by in-home or family support, which was 44%, and 40% identified employment and jobs as being important. Right behind that closely was transition to adulthood with 37%, health and wellness with 35%, recreation with 33%, transportation with 30%, and early intervention, special education, and childcare with 25%. And again, I'll be getting these data to you in infographics at a later date, but I just wanted to share that with you because I think it's an interesting way to kind of start the discussion about where people are and what matters to them. Very quickly, Kyoko got me a little breakdown of some of the data looking at the differences between our English language respondents and our Spanish language respondents. And we did find some differences, although the number of Spanish speakers who responded was not large enough for us to do statistics that would meet the muster of a scientist. I will tell you that when asked, how well do you understand New Jersey's service system? No one who spoke Spanish said, great, I understand it really well. Whereas in English, a large percentage of people indicated that they understood it quite well. In fact, 17% of those who speak Spanish indicated that they understand the system very, very well. Of the Spanish speakers who responded, 25% said that they don't understand it at all, compared to 7% of English speakers. So there were some pretty important breakdowns there in terms of people's ability to understand and work the system. Again, I'll be getting that data to you in more detail, but there were some compelling early findings, and I really appreciate Kyoko's hustle at the last minute to get that broken down for me. So next slide, Gary. Which is phase 3, developing the plan and envisioning the future. This is really where we are right now. we're at the point now where I'm going to turn back to you, the council members, with the reports from our public input session and the reports from the data and research that I've collected using sources that the National Association asked us to take a look at. And I'm going to be working closely with you to say, okay, here's what the public has told us. Here's what the data is telling us. You all have your own lived experiences. How should we spend the next 5 years? What do we want to be working on? So that's the stage at which we are now. And that will take us up through November. So it is going to be a busy, if not virtual, fall. Next slide, please. So coming up then in phase 4, we'll be developing that plan and putting that back out to the public for feedback and input, and asking the public to let us know if we hit the mark. Does the plan reflect your priorities, your input, your needs? Based on that input, we may need to revise the plan. I'm hoping not, but we may need to revise the plan, and that will be phase 5. Next slide. That'll be the final plan approval and submission, where we as a council adopt to either modify the plan and put it back out for public comment, or approve the plan as is, take care of all the technical issues, and submit that to our friends in Washington. So that sort of lays out what we hope the next year is going to look like as it relates to the 5-year plan. I'll pause there before I go through my next 8 or 10 slides, just to see if people have any questions about the process so far.
Brenda, I would just like to. Go ahead, Kevin.
That this is a great job. And as far as like needing advocates for groups, I will gladly be your utility infielder. So just whenever you need somebody in the group, that's the one I'll go to. So there you go.
Thank you.
Brenda, I just want to second what Kevin said, and I think I said it before. I've lived through 2 prior plans, and it doesn't take anything away from that work, but this is phenomenal. And I think it's particularly impressive given the environment that you've had to work in. To be able to produce the data, and the quality of this is amazing. And I think it will really inform the direction because of the homework that you did in advance. I'm awestruck at the quality of this work. I really am.
Thank you. You know, I will say, oddly, the pandemic may have helped us. One, people have a little bit more time because they're not driving. No one had to worry about childcare or parking or accessibility, other than, you know, technical accessibility. And so in some ways, I think that we're learning how to use a virtual format in a way that is able to generate input. On the double side of that sword is only folks who have access to technology can participate. And I've really needed some hands on the ground, literally, to, I have photocopied paper versions of the survey and mailed them to names and addresses that staff provided to me, because the other ways of input, you know, the digital input doesn't work. So we are learning. I am hopeful that this process lets us develop a plan that really hits the nail on the mark, because there's so much to be done. So thank you for that. Thank you. Okay, any other comments so far on process? All right, next slide. I will take us into what's next. I mentioned that we are going to be developing 3 council work groups. We're going to be reviewing data and research about New Jersey, and that research is broken down into the same key areas that we see in our survey. We're going to be looking at housing, transportation, health and wellness, childcare, recreation, employment, all those areas that that you saw reflected on the survey. And I'm going to be getting those data to the work groups. We are going to be beginning to meet in a virtual format. So that is kind of the next deep dive. Next slide. So the way these council work groups are put together, I've joked, is sort of the way the cable companies bundle your cable package. not every group is going to have everything you want, and some groups are going to have things you're not that interested in. But we really needed to break this up a little bit and make sure that we were covering the issues in ways that made sense. So work group 1 is going to include employment, transition from school to adult life, and transportation. So give some thought to whether that's an area where you might want to spend some time helping us look at what needs to be done. Work group 2 is going to be busying itself with housing, family support, and recreation. And work group 3 is going to be spending its time on special education, childcare, healthcare, wellness, and safety. And there is some overlap. Obviously, issues like wellness and safety may overlap with housing issues, and transportation may overlap with special education. So we are going to see some overlap. But the way these work groups are going to take shape is that there will be a staff person from the council, in addition to myself and members of our planning committee, who work with council members on these. You're not going to be expected to write a report or do the research yourself. We're going to be going over the research. It's really more of a process than a product. I want to review the research and review the findings from our public input process with council members to find out what you think and what matters and what you think priorities ought to look like. So they are going to be process-oriented decision-making discussions. So as you sign up for these, I don't want anyone to worry that, you know, I don't know enough about that topic, or, gee, I don't have time to do research. That part of it's going to be done. What we need is for you to react to and respond to what the data and the research sessions taught us. And I hear some things coming in on the chat. Just let me make sure. Okay. So those are the 3 work groups, and we will come back to them before we end today. Next slide. Work group tasks. What are we going to be doing? I mentioned a little bit. We're going to be reviewing the data and the research that we've collected. We're going to be considering that public input, and we're going to be asking questions like, what are the barriers to service delivery? Are there opportunities for innovation when it comes to policy, practice, funding? We're going to be looking not only at what the problems are that got identified, but what might some of the solutions look like. I will mention in sort of a parenthetical way that a lot of the feedback directly mirrored the report that was provided by the Ombudsman's office. And I know he was on a call the other night, and I mentioned to him that some people, in lieu of submitting comments, just forwarded his report. So if you want a sneak preview into what some of the data are showing us, you can certainly read the Ombudsman's report. He really did describe an awful lot of what we heard from families. So there is, as researchers like to say, inter-rater reliability there. So I mentioned our work groups. In addition to the things that, in addition to those sort of topic areas, employment, transition, housing, family support, recreation, and in addition to those topic areas, I'm going to be asking each work group to think about 5 cross-cutting areas. And these are things that I didn't want handled in a silo. I didn't want us to look at diversity and inclusion as a standalone, because that affects everything we do. I didn't want us to look at interagency coordination and collaboration as a standalone, because that problem cuts across every single system. So in addition to looking at the nuts and bolts of this, of what's happening in each issue area, I'm going to be trying to guide a discussion with each work group on these 5 cross-cutting considerations: interagency coordination, collaboration, reducing red tape. Across the board, that was something that people identified as a barrier, no matter what the system was. Quality assurance, safety, urgency. When you call and you need help, you don't want to be put on hold or told someone will call you back in 3 weeks. When you make decisions about a group home or an apartment program or supports for your son or daughter or yourself, you want to make sure that the food that you're going to get served there and that the supports you get are safe, whether you're in school or a residential facility or on a bus. So quality assurance, safety, and urgency are things we're going to be looking at, again, across all those work groups. Diversity, community inclusion, cultural competence. We're going to be asking questions about how those service systems respond to different communities and whether or not they are meaningfully adjusting their service delivery models to meet the needs of people in other communities and with other cultures. We're going to be taking a deep look at technology, especially now. We've all had a crash graduate course in how to use technology, but it's time to sort of take a step back and say, well, what have we missed? And who are we missing? In a meeting like today, if someone can't get on YouTube, they can't participate. And even with YouTube, obviously we had a problem with that today. So taking a look at technology across those issue areas. And last but not least, person-centered services and systems, asking how are people with disabilities involved and engaged in the system, not only as it relates to planning their own services, but also as it relates to planning the system itself. So those are going to be our cross-cutting considerations. And from that, I'm hoping we're able to generate goals that include activities across all of these areas. So that is sort of a sneak preview into my thought process. I am mindful of the time. I could, Paul, if we have time, have Gary advance to some data looking at New Jersey, a state portrait, and kind of go through some of the demographics, the early part of the data. Or I could hold that and we can do that in work groups. Do you have a preference?
I think you should take a few minutes and try to.
Okay, happy to. So then next slide. One of our tasks is to provide a state portrait of New Jersey. And what I've done here is just provide basic demographic information. So you've got a sense for who we are as a state. And okay, so you've got the slide up there. Thank you. So you'll see that the median income in New Jersey is $81,000, the 81 household, the median household income. National average is 63,000. So you can see as a state, not surprisingly, our median household income is higher than the national average. Our poverty rate is lower than the national average. We have a 9.5% poverty rate. Our employment rate is better than the rest of the nation. We have, well, as of the time when these data were collected, I don't know what they are now. Obviously, with COVID, things have changed dramatically. So the employment rate in New Jersey is 62.5%. The national average is around 60%. You can see that in terms of children in poverty, we're doing better than the rest of the nation. But I will add that there are counties in New Jersey and communities in New Jersey that are not really aren't showing up in these data, because if you go into certain communities and certain neighborhoods, and they're not all urban, some of them are very rural neighborhoods, the rates of poverty, the median household income is very, very different. So in some ways, New Jersey is a lot like Tennessee and Connecticut and Southern California and Northern California and Colorado. We're kind of a state within the states. In terms of the needs of our communities and the needs of our population. So I don't want you to believe that the statewide average demographics tell the whole story, because we really need to dive into some of the county data to better understand how diverse our state is. When you take a look at language other than English, you begin to see what we're talking about. Nearly a third of all people in New Jersey speak languages other than English, whereas it's just 1 in 5 in the rest of the country. So that gives you a sense for kind of where we're going and how things are going. Prevalence of disability is 10.2%. The national average is 12.6%. This is all disability, not developmental disability. Those without health insurance, we are doing better than the national average here also. You'll see that I put an asterisk down there so you can get a sense for what healthcare reform did for our state. In 2014, almost 11% of New Jerseyans were without health care. Now we are at 7.4%. That's incredible when you think about that in terms of the impact on individual lives, but also on public policy. So that's just a double asterisk item there. Next slide takes a look at demographic trends. This is sort of a different way of breaking down some of the diversity data that I provided to you earlier, showing how just in the last 10 years, the number of New Jersey residents who identify as white has remained relatively, has shrunk over time. The number of Black and Hispanic people has grown, and the number of people who are Black has remained relatively static. So you get a sense for kind of where we're going as a state and what those diversity, when we talk about inclusion and diversity, that the idea that, we are mostly a white community is very quickly becoming an outdated idea. And then when our last slide, we look at disability in New Jersey. This is new census data, 2014 to 2018. And it just sort of breaks down. Again, this is disability, not developmental disability. And one might ask, how can that possibly be? There are 240,000 students in special education. I've got some questions about these data as well. And I think that's why when we dive into the individual issues, we're going to be looking at a number of different data sources to help us better understand what these mean and how to put these into context. And so that was the plan for data presentation today. I do hope, as I mentioned, to get more general information about our survey respondents and more basic New Jersey demographic information out to you, as well as issue-specific information out to you through our work groups. So I will wrap that up and again, open it up to any questions that you might have. Gary, thank you for your help with the PowerPoint.
Brenda, I don't know why I'm echoing, but so I had a question about, well, I mean, like you do, some of the data we're going to have to dig a little further down in, but I think we also have to remember the poverty numbers, even though the percentage at the federal poverty level, really it's double that for New Jersey because of cost of living.
Right.
So it might be that below the federal poverty level, but in comparison to other states, it's like double that number because of the high cost of living in New Jersey.
Right.
So I just, I wanted to throw that in there, and I'll be interested in some of the disability versus special ed versus numbers that we can come up with as well.
Here,
Thanks for this hard work.
I'm probably going to turn to our colleagues at ACNJ to take a look at child poverty numbers and because they really drill down into individual cities and communities. And I think that that's where, to your point, these averages, if one has $100 and one has 0, the average is 50, but no one really has 50. And that's kind of where we are with some of these, some of the demographics. It misses the whole story. So I appreciate that. Thank you.
And let me just recommend, I know I sit on the Anti-Poverty Network, and Legal Services in New Jersey also has some really good data on digging down, like you said, down into it. So let me know if I can help.
Thank you. Any other questions, thoughts, comments, ideas? Again, this is a very fluid process, and I am wide open to feedback for things that you want to make sure we don't miss. Recitas reminds us about that 2020 census. If you please make sure you're getting that information and early voter registration information out to your constituent groups. I added the early voter registration.
Remember, on the census, you can do it online, you can do it by paper. If you do neither, someone will contact you either by phone or by ringing your doorbell. And just make sure that that is an authorized person. But I would strongly recommend that you do it online or in hard copy so that you don't have to worry if the person contacting you is legitimate.
Okay. You will be contacted in the coming days to find out which of the work groups you're most interested in. We'll have a schedule of virtual meetings, and we will take it from there. I thank you all in advance for listening and also for your participation in the work groups.
I just want to elaborate. I am not allowed to require you to participate in one of the 3 work groups. I certainly encourage you as strongly as I can. This will determine what this council does for 5 years. So if you want to be, a participating member of the council, you really have to participate in the 5-year plan. So, and also Brenda has done so much that we need to show her respect and support her as she continues to lead this process. So please, seriously, I need you, we all need you to focus on at least one of the work groups and try hard to attend the meetings, because I don't want to get into a situation where at the very last stage, when we're under pressure to approve the 5-year plan, we have too many people who have not really had their input, have not really focused on where we're going, and then come up with a lot of ideas. My first meeting as a council member was at the offsite for the last 5-year plan. And it was clear to me that there hadn't been a lot of good preparation, which Brenda is doing. And there were just too many people suggesting things, and it kind of overwhelmed the process. And we wound up with too many objectives in the plan. So please, this work group is when you need to start giving your input, having your influence, having your perspectives included in the plan. This is a great opportunity for everybody. Again, you don't have to write anything. You don't have to write a report. As Woody Allen said, 95% of life is just showing up. And that's really what we're asking you to do. Please just show up. And when you do, you'll be informed and you'll have an opportunity to give your perspective. That's all I have to say on the subject. Please try to participate.
Great. Thank you.
Okay, I think we're just about done. There won't be a second public comment period because the public was not able to participate. They did not get the live feed. Clearly, we have to make sure that this does not happen again, because as I stated at the very beginning, we are bound by the open public meeting law, and we clearly, we're out of compliance with this meeting. I think we have a reasonable excuse. Obviously, there's a lot of technological problems. I suspect a lot of this is because so many people are online that bandwidth is very scarce. And I know in everything I do, it's much slower than it normally is. And very often my iPads just freeze up. So, I'm not sure what we can do about this, but the staff will certainly be looking into it. And I'll be speaking with Mercedes later this afternoon or this evening on what the council can do to make sure that this does not happen again, because we can't allow this to happen for a second time where the public has no access to us for half a year. Anyway, we promised that we would be done at 2:30. There's only one item on the agenda that's left. It's not, I hate to use the word compulsory, but it's totally at the discretion of the members. I will stay on for what was listed for 2:05 to 2:20. This is the time for members to speak to one another. We couldn't do it in person as we normally do. We're trying to give members the opportunity to speak to each other virtually. So, if you have any advice for your fellow members, if you have any experiences that you want to pass along, any recommendations, this is really the time. So please, if you have something, raise your hand.
Paul, this is Kevin. Sorry to interrupt. I have to run, but I would highly suggest that we give Sophia a good 2 minutes or so just to let her explain her diversity committee project.
Thank you for reminding me. I neglected to do that.
Elizabeth
I was
has
staring
left
at
the meeting.
than what my notes told me to do. Please, Sophia, give everybody some insight into how you plan on proceeding.
Ellie Byra.
Has left the meeting.
Hi, hear me?
Yes.
Okay, I'm sorry. I was charging my microphone, so Kevin kind of blindsided me.
No, he was right. I was supposed to give you that opportunity, and I
That's
apologize.
perfectly fine. Yeah, I mean, we had a lot to get today, and most of our time, I think, was spent actually trying to combat tech issues. So believe me, I do understand. And I just thank you. First of all, I want to say, if we can, I mean, I'll even come on screen for a moment to just give a standing ovation to Ellie and all of her work, her hard work, her selfless work that she has afforded us in the in heading the policy committee. It is definitely she's offered such a great contribution. I don't want to say it's a loss because she's still here, but you know, I really appreciate the time that she has spent in advising me and mentoring me and so many others. So now I have to figure out how to come on camera. Oh, here I am.
Well,
So thank you, Ellie, so much.
Ellie left the meeting just before you started, so we can applaud in absentia.
Yeah, exactly, because it's recorded, so she can see it. She can definitely go back and see it.
That I will make every effort to keep Ellie on the council. It involves some groveling, but that's quite all right. I'll do the groveling.
Yes. So now, in regards to the ad hoc committee came about through discussions that we had in the executive committee meetings, and we definitely can't overlook what's been happening in the world. And the fact that there have been so many awakenings, if you will, when it comes to understanding the disparities, when it comes to race in particular, and especially when it comes to the disparities and the disenfranchisement of black. And we can't overlook is the fact that there are also disparities and differences when it comes to a service delivery and the impact of disability among Black families, among minority families, among families of people who are immigrants, if you will. And we also have to look at the poverty piece as well, which is really important. And the poverty piece does connect to urban communities and likewise is connect to rural communities. So it's just really important for us as a council. It would really be irresponsible for us to not look at racial, ethnic, and income inequity among people with disabilities and families impacted by disabilities. So I'm just looking forward for people to come and be a part of this process. I think also that as doing this and reflecting on this and collecting data, information, sharing stories, and presenting ideas on how we can bridge these gaps. I also think that it's very important for us to look at ourselves inwardly, to understand not just how these disenfranchisements impact us directly, but how they impact others. It's also important for us to consider how some of our actions may impact others, whether directly or indirectly, whether intentionally or inadvertently. Sometimes we do things, sometimes we say things that we don't always realize may be something that could be offensive or something that where we might lack sensitivity. So cultural competency is definitely one of the areas that we look at as we come together. But cultural competency is, I don't want to say it's not enough, but cultural competency is not where the work ends. I mean, you know, there's disproportionate criminalization of people with disabilities, and then there's disproportionate criminalization of people who are Black and brown with disabilities. We can look at situations on a national level. What happened to a young man named Elijah McClain? We can look at something that happened to a young man, Elijah McClain, I believe it was in Oregon. Matthew Russian, a young man with autism who was arrested and actually sentenced to 50 years with 40 years served. So he has to do a mandatory 10 years. You can also look into names just to find out all of this information. From Virginia, there was a child, Alejandro Ripley, son of Patricia Ripley, with mother in Miami, actually had drowned her son. And sadly, when you look at this and you wonder what could lead a parent to this, the reason why it becomes a racial or a racial or ethnic concern is the fact that the mom chose to not only mom said basically that there were Black men who kidnapped her son and possibly killed her son. So it was racialized. There are stories where I recall where Black and brown direct support people were out in the community with their clients or with consumers who were white, and they may have been questioned or accosted. I mean, all of these things are just really important. We look at also the way that the dollars are placed or not placed into urban communities and into rural communities as well. When we look at counties like Warren County, particularly cities like Phillipsburg, when we look at the dismantle of the Abbott districts and how those funds were disseminated into special education, the fact that so many boys are in special education and being classified. So there's so many areas for us to touch on, but as a community, when we come together, we'll definitely be able to we'll be able to dissect this. We'll be able to look at what are the most impacting issues for us to discuss right now, and I'm hoping that as we do this work, that the work is progressive and that it's not just a one-on committee where we look at these issues and we stop there. But I mean, the buck stops with us, and I say the work has to be intentional and it has to be internal as well, because it's really important for us as individuals to determine how we may, as I said, view a people. Some of our own ideas regards to stereotypes. I remember once myself, I can admit that I attended a PIP graduation and I thought that a self-advocate was a dad. And that may have been offensive to him. And I asked him, oh, well, tell me about your child, children with autism. And he says, I'm not a parent. I'm here as a self-advocate. And I had to recognize that may have very well been offensive to him. And so that's why I do the internal work as well as the external work. It has to start within. And so I have some suggestions and recommendations that as I'm sending out the invitation emails, I will include more information about that, because I have recommendations on what we can do. And particularly, I attended a workshop Tuesday that's sponsored by Rutgers University, and it's called the Racial Healing Circles. It was a very diverse group of people. Unfortunately, the workshop I attended was the last for the summer, but they will be opening back up in the fall, so I'll definitely be sharing information about that. I'm just looking forward to this, and I thank you for taking charge and understanding that this is very, very necessary. And as I said, I mean, as a council, we'd be remiss if we did not look these types of disparities and how they impact all people with disabilities.
Thank you very much, Sophia. I really appreciate you taking the lead on this. Clearly, everybody we represent has disabilities and has disadvantages, but it's clear when we look around at programs and services that there are parts of our community that are very, very underrepresented among those receiving services. That is unacceptable, and we can't allow it to go on. I mean, and the buck has to stop here. It has to be the responsibility of this council to take a stand and stop this from continuing. So, thank you so much for taking this responsibility on. I greatly appreciate it. Okay. I am looking at it where actually we did this in 2 hours because we started late. because of the YouTube issue. I've exchanged emails with Mercedes, and she assures me that the problem is not with WebEx, it's just with YouTube, and we don't understand why, because we were on the live feed and then we lost the live feed. But I will speak with her later, and again, we have to make sure that this doesn't happen again. So I will just extend one last invitation to the members. If there's something you want to speak about, if there's something you want to bring to the attention of your fellow members, please, this is the time to do it. So we'll just take a minute for people to collect their thoughts and see if anybody wants to speak up and out.
Hey, Paul.
Hi.
I do. I was just raising my hand, so.
Okay, go ahead, Ryan.
Now, hi everybody. I'm sitting up right now. I was told privately by Gary Brown, so I gotta act professional. Living in my comfort zone, and I try to literally, be focused on what's really important, the agenda. So, what's going on with COVID. I just was interviewed by Brenda Considine, and how COVID really affected, my, employment, work at the church and in my, very much easy. Is Bill speaking? I'm sorry. I thought Bill was speaking. Sorry.
The floor is yours, Ryan.
Okay. I'll let you speak, Paul.
Go ahead, Ryan.
Oh, I'm sorry. I really want to say congrats to Ellie Byra, because I know she's actually retiring from her position when being involved with the council, but I know she'll be a respected member of the council. I think, she really fought and every tooth and nail when it comes to advocating for people with disabilities, and especially their families when the system and services. That's really much important. And even quarantine, dealing with the COVID pandemic. And also really want to say that I'm going to really miss Denny Todd, who I actually met her almost 8 years ago when I started being a participant for the Partners in Policymaking program that's through the DD Council before the Boggs Center took over. And it was really amazing and an honor, an humble privilege to really get to know Denny in person, especially that she was a survivor dealing with a brain traumatic injury, and she really impacted me a lot with her wisdom. And she taught me, and she brought in many speakers who really made me understand the importance how to acknowledge people with intellectual or developmental disabilities, and especially with James Brill, who I met 6 years ago at TCNJ when the DD Council had to really do like a very important program. I think it was really much more like a seminar regarding about starting up advocacy groups like People First, and it was all for people with intellectual or developmental disabilities from different advocacy groups and everything else. And then especially having him be involved with the council, and especially reading so much about his brother Mark dealing with an intellectual disability as well, and getting to know that his parents are very active with the Family Regional Support Council, and being involved with self advocates, and taking in so much part of it. So I know that Frank Layden will really be more of in his place right now. He'll make a better asset to the cause, as he usually does. And I can't wait to have him be part of my meeting next month. So I know, keep up with the great what you guys are doing. I mean, he actually interviewed me for the survey that the DD Council was doing. So I just want to make sure everything's all on deck, and maybe talking about when it comes to really really looking at the council if they go according to plan.
Thank you, Ryan. Unfortunately, I guess the health emergency has slowed the process of getting the governor's nominees renominated and confirmed to be appointed to the council. A lot of things that should have happened are not happening. Would anybody else like to take this opportunity to speak to us?
Hi, this
Okay.
is Annette Smith. I just wanted to say to Sophia that ask her to reach out to me to let me know in whatever way I can assist her on this committee. I think it's something that has needed to be addressed for a long time. I've come in contact with a lot of individuals with developmental disabilities, and I've been really concerned about their health and safety in the community, and being involved with the police department and their education about knowing how to identify people with disabilities. So I'm looking forward to this. Been looking forward to something like this for a long time. So please contact me and let me know how I can assist.
Thank you, Annette. While we can't fix all of society's ills, what we're trying to do is get equal access for all people with developmental disabilities. But as we look around, we can see that even people who do not have any disability, who would seem to have all the attributes of successful people and are successful, still have difficulties. I remember several years ago, I got an invitation to an event at the New Jersey Law Center run by the State Bar Association. The speaker was a lady named Carlotta Walls-Lanier. I'm sure most of you or all of you have not heard of her, but when I was a child, I think it was about 1955, the United States government, led by President Eisenhower, had to send federal troops into Little Rock, Arkansas, to integrate Central High School in Little Rock. And I think it was 8 African-American students were escorted by the United States Army into the school past Governor Orville Forbes, who wanted to prevent them from integrating the school. Ms. Lanier was the youngest of the 8, and I was very eager to meet her, which I did. I still have a couple of pictures that she allowed me to take of her. But I was struck by 2 things at that session. One, what a wonderful person she was, that she had no animosity towards the people who had given her a hard time when they were her fellow students, and that she graciously accepted their apologies 20, 30, 40 years later. Second thing that struck me is I invited a friend of mine from the Middlesex County Human Service Advisory Council, an African-American, very respectable person. He was actually a former chair of the council, one of my mentors. And Chan came with his wife to meet Ms. Lanier. And I was very struck by my conversation with his wife. She was a college graduate, very educated lady, and she had participated when she was a college student in upstate New York, traveling to the South for some of the demonstrations and the sit-ins and buses and lunch counters. And she told me that her father strongly advised her not to go, that he was afraid for her safety. And I realized the tremendous courage that people had when they stood up for their rights. But what struck me the most is that she has a son who worked in New Haven, Hartford, Connecticut. And she was fearful that despite the fact that he was an educated, successful engineer, she was afraid that when he drove from Connecticut to New Jersey on Friday nights to spend the weekend with them occasionally, that because he was driving a nice car and was a black man, she was afraid that he would be stopped by the police on the Connecticut Turnpike. And I mean, this was just a mind-blowing experience for me because I could not imagine that happening to my son. And there really was very little difference between my son and her son, except the color of his skin. And when she said this, she was not the only person sitting at our table who had that same fear. And then I realized, my God, if people of this caliber, people of this success in life, this education, this refinement had this fear, what can we expect for people with developmental disabilities who are members of minority groups? Will the expectation always be that there's something wrong with them, that they belong in jail, that they're escaped prisoners? I don't know, but clearly we have to look into this and offer people with developmental disabilities all the support this council can offer them. So I'm sorry, but this was just something that I had been thinking about for a long time, and these two events, which were connected, the integration of Central High School 65 years ago, and my opportunity to meet and speak with Ms. Lanaya were connected, and they just brought back and reinforced the thoughts that I have. So I'm very much committed to this. I think we all are. I would just like, just a show of hands that the council members support the creation of the ad hoc committee and its charge, its work assignment. So please just raise your hands so I can say that the council this. Thank you all. Thank you all very much for that support, and best wishes and thanks to Sophia for taking the lead on this. But we
Paul,
all
can I
have a
just,
responsibility to support her.
I'm sorry.
Go ahead.
Can I just thank you to Helen for sharing that beautiful poem. It was so relevant. It was so familiar. I saw myself. I saw my children. I saw my mother and her challenges as someone aging and needing help and support. I didn't see anyone. I saw everyone. And it's so impacting in the name of it, and see me. And I really appreciated it. And you reminded me of the days when Kathy Roberson was at the Bog, and she started the Writers Workshop for Caregivers. And we started out as caregivers and family members who we wrote a little bit. So we started getting together collaboratively, and she even produced a book for that. So maybe that's something therapeutic deadline that we'll revisit. But it was, yeah, it really, it ignited something in me as a poet. So I really appreciated it. Thank you for that.
Q&D. That was really got straight to the heart of how we view our loved ones and how we'd like the world to view them. Okay. Again, I just want to thank everybody for participating. And I assume at this point, as I must, that our November meeting will also be a virtual meeting. Sadly, I also just want to reiterate for those who are interested what Mercedes had said. The 10-person committee on reopening the day programs that she served on submitted their recommendations to Jonathan several weeks ago. I assume that he made some modifications, and then he said 2 weeks ago that he had sent it on to higher authority. And again, I don't know whether that higher authority was the commissioner of HHS or DA, the Department of Health, or the governor's office. But he is hopeful that the plan can be made public next week, although I doubt that we'll have a date for its implementation next week. My own personal view is that they're probably waiting to see what happens with the reopening of schools. Right now, the governor is hoping that some schools will open, and the teachers union is strongly opposed to reopening any schools in September. I think he's left it up to the individual districts to make those decisions. The polls show that the majority of adults in the state do not think it's a good time to reopen the schools. So my fear is that if the schools are not reopened, it will be very difficult to reopen our day programs. Hopefully, the schools will at least open for special services, because we all know you cannot provide special services online. Therapies have to be done in person, and they have to be done in the school buildings. So we'll I hate to say it, but it's pretty much up in the air. But hopefully, at the very least, the special education students will get some direct services. They have not had anything since March. And from talking to a lot of the parents of school-age children, they're very much concerned that their children are regressing. I know just from my personal experience, we had to take my son home from his apartment on Sunday. The stress of being isolated, not seeing his friends, not getting away from his apartment, not going to his day services, not going to his recreation programs, not really being able to come home and visit family and friends was just more than his system could handle. And I'm sure there are many, many others throughout the state that need to get back to their normal lives. We're trying to reopen the state for everybody but individuals with developmental disabilities. And the state just has to figure out how we can open up and let our children and our siblings get back to a semblance of the normal life with reasonable safety. So that's my closing comments. I just hope that DDD can work with the Department of Health and figure out some way, because we cannot just continue to isolate people in group homes or supervised apartments for an indefinite period of time and ignore the fact that it has a deleterious effect on their behavior, their mental health, and their physical health. At the same time, I just want to single out one more member of the council, Bill Testa. I think it's amazing and remarkable that the provider agencies like Bill's have been so successful in limiting the number of infections and deaths over 5 months, when we can see how disastrous the results have been in nursing homes, which once again tells us that we have to get our people out of nursing homes. But thank you very much, Bill, and all your colleagues running agencies. I think it's just been a remarkable achievement that you've put together.
Thank you, Paul.
Well deserved, Bill, well deserved. You deserve all the plaudits. So if there's nothing else, I will call this meeting to an end and look forward to seeing all of you in November, unless I see you at the subcommittees. So thank you all. Thanks, Ryan.
Andrew McGee.